Will, Blessy, Deepak, Geeta, Hipsa, Kabir, Kalai, Sanju, Srija, Sukhvinder, Vinita, Ranjit. Will, Blessy, Deepak. Yeah, most of the students are regular students and some of them are our guests. Welcome to the guests for attending this platform for the first time. This is a demo session for the new batch coming on Monday. Yes. You can send this invite link to your friends. Yeah. So, right. Here you have the paragraph just to go through this. We'll do a faster revision now. Very fast revision. Yeah. Okay. This is obesity. This is text A, which is talking about overweight and obesity. But here for the identification and classification. So classification, we are doing classification. Classes. Okay. Kinds, types, groups, categories. Okay. All these are one and the same. Next is text B. Tailor dietary changes. Tailor dietary changes. Tailor dietary changes. Yeah. Tailor dietary changes. So dietary regimen, diet, food, see all these things. Very good, 15 members, very good. Somebody's mic is on, Nadia. Dr. Nadia's iPhone. Okay. Let me mute everyone. Yeah. So this is dietary regimen, diet, food, calories, intake, consumption. So A is classification, classes. B is dietary regimen, diet. Now C is pharmacological, pharmacological. That means pharmacy. That means medication, drugs, analgesics, injections, medicines, tablets. Without reading how to get answers. Okay. I'll ask you one question now. Okay, after this one. Now, pharmacology means medication, pharmacy, medication, drugs, analgesics, injections, medicine, tablets. And next, surgery procedure. So surgical options. So surgery, surgical option, surgery, procedure, operation. Okay, surgery, procedure, operation. Right. So now we have noticed these 4 things. Yeah. We have noticed these 4 things. Now I'm going to ask you some questions. Now, first of all, I want to ask you one thing. Regular students don't respond. Regular students don't respond. Who is this Del Sukhvinder Kaur? Sukhvinder, when you come, you can just enter the name. Okay. Sukhvinder Kaur. So that I can recognize. Okay. Sanju, second name. Blessy, second name. Okay. Fine. Now here, I want to ask you. If regular students, those who are registered regular students of Grand Master class, don't respond to these questions which I'm telling you now. Sir, those students are out just 1 second. Sir, right. If someone says, I took their name and they went off or what? No. So if someone tells you that you need not read the texts for answering many of the questions. Okay. Will you agree? If someone tells you that you need not read the texts for answering many of the questions, will you agree? No. Dr. Nadia say no. Will you agree? Yeah, Kabir Singh says yes, definitely. Sanju says no. Okay. Right. Good afternoon, Mansi. Now, regular students, Grandmaster class students. Now it is your turn. You tell me. If someone tells you, you need not read the texts. Okay. You need not read the texts. Will you agree? All the regular students. Will you agree? All the regular students, please respond. Okay. Now, how much percentage is agree and how much percent is disagree? So if you 100% agree or 0% agree, 0% agree, they already told no. But now you people, those who say we agree, you say 0 to 100%. How much do you agree? Sukhvinder says 100% we agree. Yeah. Thank you, Sukhvinder. Yeah, what about others? Avil says 100%. Kabir Singh says 97%. Yeah. Yes. Kalai says 100%. Blessy says 100%. Yeah. So, Deepak Moily says 100%. Yeah, Deepak, very good. Morning's video is there. You can watch later. You can ask me for the link, I'll give you. Right. Coming to the point, now I'm asking you. 4 things were there, 4 texts. 4 texts. 4 texts. I have shown you 4 texts. Now, no need to see any text. No need to see the text. I'm asking you. Text 1. What title do you want to give for text A? What title will you want to give for text A? It is written there, obesity and overweight and obesity something. What title will you give for that one? We have given a lot of titles there in blue. I have shown you. You can give one simple title for that. Overweight, no. Definition, some extent. Yeah, classification, yes. Kinds, yes. Any other definitions? Classification, kinds, what types? Kabir Singh says types, very good. Recall the words. Remember the words. Make your knowledge powerful. Make your brain very powerful. Groups, yeah. Groups, very good. Types, very good. classes, types, kinds, categories, groups, divisions, departments, sectors, areas, specializations, fields. So these are all one particular group. Right now, if I say text B, if I say text B, what title can you give? Remember, I will not show you the text. I have already shown you. No need to read. No need to read. Yeah, Vinita says diet. Avil says food. Come on. Kabir says management. Okay. Diet. Okay. Food. Okay. Intake, consumption, ingestion. Okay. Yeah, intervention. Okay. Right. Next one. If I say text C, what title will you give me? It is talking something about pharmacological intervention. Second one is general intervention. This is pharmacological intervention. It is less important. First one is more important. First one is prevention. Diet is prevention. If you take proper diet, that's enough. Yeah, drug treatment, analgesia, therapy, drug treatment, analgesia, therapy, injections, medications, tablets, analgesics. Okay. Next, if I say text D, then what title will you give? Yeah, surgery, surgical management. Yes. Yeah. If you love this session, you can invite one or two friends. If you really love this session, invite one or two friends. That is all what I ask you. You attend regularly and invite your friends. Maybe they will be interested. Yeah. So fine. Right. Now I will give you jumble up. I'll give you anything on any order. Right. If I say obesity, the extreme level, obesity in the extreme level, where will you go? A or B or C or D? Okay. This is how I'm telling you, I'm making you to improve your memory fast. This is speed, rapid fire round. Rapid fire, bullets will come. Fireballs will come and fall on your face. You have to protect yourself. It is called rapid fire round. I think you know what is rapid fire round. Yeah, next I will tell you. Next point is, okay. Um, the next point is, if I tell you, if I give you a word, a name of a brand medicine, a name of a brand medicine, Where will you go? Wow, wonderful. Fat, 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 fat. See, this is talent. This is talent. Okay. If I talk about an operation room or operating room, wow, 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 people are ready. Wonderful. I really love you all. Wonderful. Wow, you make me proud. That's awesome. Okay, next one. If I say slightly overweight, slightly overweight, slightly overweight, then sorry, what is this? Slightly overweight. Where will you go? Slightly overweight. If you can answer my questions, that means you'll get 20 out of 20 in 10 seconds, 10 minutes. 10 minutes. And many of the students who will get 20 out of 20 will finish in 7 minutes only. All the questions. That's done. That's done. And if you want to test this one, bring more students to me. Okay. So, if I tell about, if I use a word, then the generic name of a particular drug, the generic name of a particular drug, where will you go? Wow, 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 wonderful. If I tell you about, okay, nutritious diet, nutritious diet, where will you go? Very good. That's it. That's it. 17 members are there. Okay, you can invite our, you can send our link to our friends and we can get to that one. Okay, next one. So these are the headings. Yeah, these are our headings. Learn by heart the headings. You will have a question number. And this white area is very precious. Where you will see the question, this will change. Only this will change. Nothing else will change. The question number and the question will change. The question number and the question will change. Nothing else. The question number and the question will change. Nothing else. So A is types, B is diet, C is drugs, D is procedure. Yeah. I'm going to test now. Fast rapid fire round. I'm going to ask you a question. Are you ready? I want a yes or a no. Yeah, those who are dynamic, say yes. I'm going to throw fireballs at you. Protect yourself or die. And before that one, I'm giving you 3 minutes. Just to invite some of your friends. Tell them that there is something magic going on here. There is somebody in the world who is telling without reading you can get the answers. Come and check what is the problem. You can spend 10 minutes. If it is wrong, okay. If it is right, we'll benefit. Otherwise, only 10-15 minutes you can spend and go. Tell them. Invite your friends, please. Take 3 minutes. This is my request. Just invite your friends. Anybody you can call. Anyone. Yes, we have 19 members now. That's really good. No need to read anything. No need to read anything. Just see the heading, that's all. Yeah, I will explain you. No? I'll explain you. Afterwards, by the end of the session, you will know everything. Yeah, so, right. Yeah, I already told now. So hold on for a second. Hide floating meetings. Yeah. Now we can see here. You need not read anything. Now I'll show you. I'll show you. Once again, I'll show you. Don't worry. Yeah. No need to read anything. Okay. Overweight and obesity. Two names are given. Okay. What is overweight and what is obesity? They're two different. Overweight is from this term anything. And obesity is extreme. So there itself you can see that there are two types. Overweight, normal overweight, and serious overweight, which is called obesity. So deadly obesity. So that is types, classes. So you can see that. Okay, if you want to see, you can go to the first line here. No need to read anything. I'm sorry, just to hold on. All your doubts will be cleared by the end of the session. So this is classification. That means because of that one we gave title. And now classification means classes, kinds, types, groups, categories. That's it. Synonyms. We know. You're a doctor, you're a nurse. Definitely you know. Now, is that clear, Nadia? So, is that clear? All of you. Is that clear? No read. Is that clear? Just say yes or no. Heading and subheading will be in the first line itself. Heading and subheading will be in the first line itself. Submit your response. Is that clear? I told you. Overweight and obesity. Here itself, I understood. But at least if you go to the first line, here itself, you can understand classification. If you don't understand there, then still you can go here. Classes. If you still don't understand, you can go different places and you can see all the words which we have discussed. Everything will be noticed there. Okay. Right. So that is how all the things will be there. All the things will be observed here. See here. Okay. 1, 2, 3, 5. 5 classes here. Healthy weight, overweight, obesity 1, obesity 2, obesity 3. Types. Different types are there. So like that you have to identify. Now number 2. Number 2. Second paragraph, how we know. Already we finished this one. So that's why. This is for you people who joined late. Okay. Okay. Now here it is. Interventions. Interventions. Okay. Interventions. Now if you see tailor dietary changes. So dietary. So dietary regimen, diet, food, calories, take, consumption, everything. That's it. That's it. Everywhere you will see this word. Number of times you will see this word. See here. Diet, 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 diet. Okay. Then here you see diet. Everywhere you will see this diet. Dietary approach, dietary management, dietary regimen, diet. Okay. Kilocalories. Okay. Kilocalories. Diet, low fat diets. Okay. All these things. Calories. You can see everywhere all these words you will get. All these words you will get. Next. Next one is here. Next one is here. Number 3. This is for the students who miss the session in the morning. For them I am giving now. So here if you don't understand, then again see here. Pharmacological means pharmacy. That you understand? Pharmacological. That is general intervention. This is pharmacological or specialized intervention. That is prevention and this is cure. That is prevention, cure. You can write prevention and cure also. No problem. Okay. Now here, only after dietary exercise. See here. Okay. Pharmacological treatment. Okay. Treatment, pharmacy. Right. Drug. You'll get every word. You no need to read. For me, everything is here only. Yes, sir. Let us ask Dr. Nadia itself. Hello, Dr. Nadia.
Hi.
Yeah, you are a doctor, right?
Yes, yes.
Can you understand by this word pharmacological that it's pharmacy?
Yes, now I understand.
Now, before also you have, before also you can understand. Only you did not think. You are thinking that somebody told you should go like madly and read everything. Somebody told so you are
Exactly.
reading like that. Correct?
Yeah, exactly.
Huh? So somebody is telling do like this, do like this, do like this, fast, fast, fast. You have to read. So you're fast, fast, fast doing and going everything. Wherever. Okay. Now here, if you don't understand here, at least you
Yeah.
will understand in the second line here, pharmacological. Here you
Mm-hmm.
get treatment. Then here you can see what is that drug? Drug is here. We need
Yes.
only when you can. If you heading means heading. Heading only tells everything about the paragraph. Do you know that?
Okay.
You got it. Heading will tell everything about the paragraph. That's it. Next, yeah, drug. Next, if you see here, Orlistat, it's a drug. Okay, Orlistat is a drug. 120 mg capsules. Capsules. We did not write capsules. You can write capsules also now. Tablets, capsules. Tablets we discussed, but capsules. See, capsules also is there. That means capsules are found in pharmacy. Pharmacy means pharmacological intervention. That's it. So this we did not write. We can add one word here. Pharmacy. Capsules. Add the word capsules. Okay, here also it is this capsules, and here we have 60 mg. Here we have Zenicol, and here we have brand name. I told you, no, brand name, and here you have brand name. See how many times are the brand name? Ali Zenicol, Ali Zenicol. Okay, then pharmacist. Pharmacist is related to medication, medicine. Ali is here. Then again, if you see, or listed again here. Okay, then next one, or listed again here. You people know that much about this one. Okay, then you can go here also. Orlistat is here, and if you want here, medicines is here. Everything is here. What more you want? You can find the word anywhere. Okay, I prove. No, wait. Next, next one is a D. Now in D, surgical options means a surgery. Surgery, what are the other names? If you don't understand what is surgery, then you go here. Procedure. Okay, procedure. This is procedure. This is procedure. And procedures are different types. You can see here, reversible procedure, non-reversible, non-reversible, temporary procedure. All these things will tell you, you're a doctor, you're a nurse, you will understand by this one. Okay, nobody needs to tell you are a very mature person. You should start thinking like a PhD candidate, not like a high school student. That's it. Now you should know who you are talking to, who you are listening to. Let me introduce myself now. Okay. Let me introduce myself. My name is Peter Simon, and I am an English language professional. I am not like a nurse who is teaching English. I am not like a doctor who is teaching English. There are many nurses, there are many doctors who are teaching English. But I will ask you one question. If your son needs mathematics, will you send your son to an English teacher? Why not? Will you send? Will you send your son or brother or anybody who is studying in 5th class? He needs maths. He needs maths training. Will you send him to an English teacher? Say yes or no. Fast. Your answer only reveals. Will you send him to an English teacher? Yes or no? You can say, oh, that's it, fast. I want your answer because I'm teaching you some concept which is very, very important. Okay. Now I'll ask you second question. Stop. That is enough. Now I'll ask you another question. Will you send him to A maths teacher. He wants maths concepts. He wants maths training. Will you send him to a maths teacher? Yes, that is what it is. Now, you are not ready to send your son or brother or anybody to an English teacher to teach, to learn maths. He's a teacher only. He's an English teacher. But still he is not able to teach maths. Can a maths teacher teach English? Now, next question. Can a maths teacher teach English? Can a maths teacher teach English? Come on, give me your answer. That's it. Now I'm asking you, can a nurse teach English? It doesn't depend, Kabir. It doesn't depend. So, can a nurse teach English? Can a doctor teach English? Yeah, they can teach. They can definitely. People are teaching. Can a doctor teach English? People are teaching. Yeah, they can teach. But I'm asking you, what is the quality of their teaching when they don't have three things? Yeah, if he's a capable, he does not have a certificate only. He doesn't have English language certificate. Number one, university did not give him English certificate. So how can you? Yeah, 7th class student also can teach 5th class boy, Kabir Singh. Yeah, but can you trust him, pay him money and ask them to teach? Oh, yeah, you're right. The certificate is just a piece of paper. You're exactly right. Wonderful. That's fine. Yeah, that's true. So I can go and do surgery. Certificate is a piece of paper. Can I go and do surgery? Can I go and do bandage? Can I do operations? Then what is it? I don't know. Now you only decide. Can you trust me? Can I say, yeah, I tell you. But you cannot play with the life of a candidate. We cannot play with the life of the candidate. That's why so many people are failing in the exams. Okay, leave it. It's not our personal things. I'm just telling you. Fine. So you cannot allow me to play with the life of your son when he's suffering with fever and I give whatever tablet I give, you will not allow, you'll slap me. That's it. I'm not judging, I'm just asking. I will not judge anybody. I'm just asking. That's what. Okay, you can give your answer. I'm least bothered. So if you're a Kabir Singh, fine, very good. Thank you for your answer. I'm not judging, I'm asking you people to judge. I'm no way concerned. Right. First thing is, a person should have academic qualification. That means university should be dumped into the dustbin. Academic qualifications. So in that case, nobody needs OET certificate. You can just go without certificate. Why it's a waste of paper, na? Why we are trying for OET? Why we are trying for IELTS? It's just a mere waste of paper. Do you agree? OET certificate is a mere waste of paper. Do you agree? Someone questioned me, so I'm asking. Certificate is a mere waste of paper. Can you accept? OET certificate. Do you say that it's a waste of? Then why are you paying thousands of rupees? That's it. So this is your answers. Okay. These are your answers. So no problem. That's it. So be very careful when you're spending so much money. Just judge who is right, who is wrong, and how they are doing. So now we are going into the fireballs. I'm throwing fireballs. That is the difference between specialization and generalization. Anybody can teach is general. Okay, somebody can master things for you. That is specialization. Okay. Any doctor cannot do brain surgery. Any doctor cannot do heart surgery. I'm not judging, I'm telling the fact. You cannot go to a brain surgeon. You cannot go to a podiatrist for heart problems. You cannot go to a craniologist for feet problems. That's it. So go to someone who is an expert, certified person. Okay. I tell all my students, don't come to me. Okay. Because I am busy. So you judge. I am not judge for anybody. This is your life. This is your money. This is your study. This is your time. Don't. There are many people who give leaked papers also. Don't give your precious money into the hands of these people who are trying to. Don't give. Yeah, somebody is giving free certificate. They are troubling you. Take it. You know what is right and what is wrong. You should judge. I'm least bothered. So fine. Now coming to the point, we are going into the session. Get ready with your pens and papers and write down the marks. I am telling you that you will get 20 out of 20. That's it. I'm proving. Yes. Get ready. Here we go. This is the point. Yeah. So types A, diet; B, C, drugs; D, procedure. Yes. Right. This is the first question. So round one. For each question 1 to 7, decide which question A, B, C, or D that information comes from. You may use any letter more than once. In which text can you find information about? That is the point. Now, here is the point. Don't write the answer until I tell you. I'll count from 7 to 1 and then I'll say submit. Then only you submit. Otherwise, I'll remove you from the group and leave you out. Afterwards, you will not attend any of my sessions. Discipline is very important because even the last person should give the answer. So let them think. If you know the answer, don't just throw the answer, please. Yes. So think about this. Specific advice to give parents about their food intake. 7, 6, 5, 4, 3, 2, 1, and submit. Answers will come. Fat. Answers will come now. A, B, C, D. That's all. Don't write everything. A, B, C, D. That's all. Yes. That's good. 12 students have answered. What about the rest? 5 more are pending. War is one-sided with grandmaster class. War is one-sided with grandmaster class. Yes. Now let us check your answer. Okay. I will not give the answer. What you have to do is you have to check your answer here. I'm giving you the link. Check your answer because many sessions are there like this. You can just check. And if your answer is right, it will throw flowers on you. If your answer is wrong, it will shake your earth. So this is the first question here. Copy post link. Yeah, here is the point. You can go there. Yes. And here is the second link. Copy message link. Here you answer. And if your answer is right, type 1 by 1. If your answer is wrong, type 0 by 1. Come on. Update your scores. All that regular students know the system. Update scores, please. Update scores, please. Next. Okay. Now we are moving to the second question. We are moving to the second question. So question number 2 is here. Specific advice, sorry, this is over. Second question. Tools for diagnosing degrees of obesity. Tools for diagnosing degrees of obesity, different degrees of obesity. Don't write the answer, please. I'll count from 7 to 1. I deleted your answer, Hifza. Wait. Let everyone think, na? Let everyone think. Everyone, even the last student should answer correctly. Let them think, na? Let them think. Tools for diagnosing different degrees of obesity. Degrees of obesity. Yes, 7, 6, 5, 4, 3, 2, 1, and submit. War one-sided it will be. I know that. Will you find in types? Will you find in diet? Will you find in drugs? Will you find in procedure? This information. Think logically. Yes. Respond. Don't be silent. Yes. Now again, you can go to the question. Okay. And here is the question's answer. Second question here. You have to click on A, B, C, D, just below this. Copy link. Yeah. Oh, sorry. Copy link. Yeah. Here. So you can go there and you can answer the question. Copy message link. Yeah. Don't write the answer here, Kalai. Yes. So if your score, update scores, please. Do we need anything here? Many people say nobody can teach you reading, nobody can teach you reading, nobody can teach you reading. You have to do your own things. Nobody will give only materials. So believe them. And you are at a difficult situation. Okay. Now see here. The logic behind this one is here. Okay. So here, food is related to diet. What more you want? Food is connected to diet. It's linked. There is nothing else. One word will help you to go to the answer. So why are you bothered? Why are you bothered? You'll get the answer. Dance the show and tell them that yes, we can learn it in different way. If you go to an expert, okay, you can go and you can learn different. Yes. Next. Now here, second question. What is the secret here? Let us see here. Tools for diagnosing degrees of obesity, levels of obesity, levels, degrees of ordinary obesity, moderate obesity, high level obesity, extreme obesity, far extreme obesity, degrees of obesity. Degrees means different types of obesity. Okay, types. Maybe that is the how you have to Identify. It may be right, it may be wrong, but try, na? What is wrong in trying? At least if 50% of the answers you get like that, that is well and good, na? Yeah. Where is the text? Yeah. Obesity. Right. So I think you got a little bit. Are you convinced? If you are convinced, then dance now and find all the questions and get 7 out of 7 and say, yes, there's a difference. Are you convinced my opinion without reading? Can you get the answers? You only saw everything. Are you convinced? Yes or no? Just 15 minutes you will wait, now you will know everything. Yes. And still, if anybody is not convinced, then you can take your choice. Because if you cannot trust the teacher, you cannot learn from that teacher. That's the point. So you can take a U-turn and you can learn in your own styles. Yes. Right. Next. Third question is here. Third question is here. Don't write any answer now. Okay. Don't write any answer now. Don't write any answer. Yes. Different types of medication to prescribe for obese patients. Different types of medication to prescribe for obese patients. Yeah. 7, 6, 5, 4, 3, 2, 1, and submit. Yeah, 13. Very good. If you agree with me, afterwards you can invite your friends. Yeah, 16. Very good. Wonderful participation. That's lovely. That's lovely. Yes. Now let us see here. Okay. Question number 1, question number 2, question number 3 is here. Copy, post link. You can check your answer and update your score. Copy message link. Yeah. So anywhere you can click and you can check and you can update your scores. Yes, update scores. I need not ask you every time. You're not small children. Once you get your score, immediately put there. Update scores. How will you not get the marks? I will see, na? I'm there for you. I'm standing like a commander and you are my soldiers. If you don't win, then what is the benefit of the commander? Yes, ho. Now next one. So next we are moving to, sorry, I have to explain this one, right? Yeah. Now here, the keyword, can you tell me what is the keyword which helped you to find the answer? Type the keyword in question number 3. All of you, come on. You, because every individual is individual answer. You can write what is the word which helped you. What is the need for me to explain? You are explaining me that what I'm telling is right. We don't want anybody person. We are not personalizing. We are generalizing things here. We are learning. We are learning. Yes, medicine, right? That's it. Medicine is related to this word medicine, and it is related to drugs. This is the connection. What more you want? What more you want? Okay. Right. Number 4. Number 4. In which text can you find information about the success rate of different forms of surgery? The success rate of different forms of surgery. Forms means the types, but this is not that types which we are thinking A. Remember that. Forms, types, kinds, varieties. Varieties, kinds, forms also is word for A. The success rate of different forms of surgery. Yes, 7, 6, 5, 4, 3, 2, 1, and submit. That's wonderful participation. Very good. Yeah. You can go and check your answer there. Yes, 4th answer is here. Copy post link. Copy message link. So update your scores. Next. So now let us see this one. So here, forms of surgery. Yeah. Now forms of surgery. So here surgery. Sorry. So forms of surgery. Surgery is related to procedure. And this is the connection. What more you want? What more you want? Your marks will prove. No, nothing will prove. Your marks only will prove whether what I'm telling is right or not. You only tell me what I'm telling is right. I don't need to tell anything. You should tell. I'm not a person. Okay? Yes. Yeah. So now, question number 5. How to establish? How to establish? How to establish whether adolescents are obese? How to establish whether adolescents are obese? How to establish whether adolescents are obese? Will you go into types? Will you go into diet? Will you go into drugs? Or will you go into procedure? Yes, 7, 6, 5, 4, 3, 2, 1. Now submit, Kabir Singh. Yeah. War one-sided. Right. Next, compartments. Diet only related to diet. Drugs only drugs. Procedure. Obese. Adolescents are obese. Different types of obesity. Low, medium. So automatically it is. So what type of obesity, whether they are really obese or not, how to establish will be there in types only. Okay. Right. So you can go to question 5. Check it out. What is right? Maybe right, maybe wrong. So check it out. Copy message link. Yeah, update scores. Next. Now let us see here. How to establish whether adolescents are obese? How to establish whether adolescents are obese? Only when you measure how much obese they are. So based on that, that means you have to find out their levels. They are normal weight, not obese. That means measurement. So different groups we are separating. So perfect weight, a little more weight, greater weight, obese. Okay, so definitely you will go. So obese, that itself is linked to obese, is directly linked to types. Okay, right. Next, 6. The specific factors relating to certain ethnic groups. Specific factors relating to certain ethnic groups. Factors related to certain ethnic groups. Factors. If it is related to types, you will tell types. If you tell diet, it is diet. It is drugs, drugs. Procedure, procedure. See, these factors, specific factors related to certain ethnic groups. Okay, maybe leading to obesity, whatever it is. So what do you think here? Specific factors related to, maybe genetics is one factor. Maybe think about these things. Yes, 7, 6, 5, 4, 3, 2, 1. Submit already. Yes. Okay. Now 6th question is here. Check your answer. And update scores. Please. Next, we are moving to 6th question. Yeah, specific factors relating to certain ethnic groups. Some people, it's maybe weather, maybe genetics, maybe heredity, or whatever you call. So now, if you take these factors related to certain ethnic groups, okay, maybe height is one factor. Height is one factor. So according to that height, okay, in some we call dwarfs. So then what about their obesity according to their height? So it depends on person, place, time, and situation. So where will it go? So these factors are here. Okay. These factors are talking about many other different things. It is not talking specifically about diet. It is not talking specifically about drugs. It is not talking specifically about procedure. It is talking about generic information, specific particular factors. Other than this, everything will go into types. Okay. Then next, 7. Factors informing the most appropriate inverse in. Be very careful here. Don't write the answer now itself. Okay. Factors. Here also factors. Here also factors. Informing the most appropriate invert intervention strategies. There are 2 types of intervention here. There are 2 types of intervention here. Okay. Or you can say 3 types of intervention. There are 3 types of intervention. One is dietary, second one is medication, third one is surgery. So 3 types of things. Which is the most appropriate intervention? That is what it is. Be very careful here. Most appropriate. Taking proper diet, is it the most appropriate intervention strategy? Or You become obese. Afterwards, you take drugs properly. Okay. Medicine properly, so that you will maintain your health. Or if it is even worsens, then you will go for surgery. What exactly is the most appropriate strategy? Think logically. Yes, 7, 6, 5, 4, 3, 2, 1, submit. Don't be in a hurry. The person who is in a hurry will lose marks. Yes, be careful. Think very logically. Hasty leads to mistakes, so be careful. Think. Right. Now, coming to the point, the most appropriate strategy is preventive strategy rather than cure strategy. First one is preventive. Dietary strategy is preventive. Take food accordingly, appropriately, in a systematic manner. That is prevention. Okay. Drug is cure strategy. Drugs. Once the problem arises, then medicine. That's not the appropriate. Say, for example, cold. Preventing from cold is better. You eat ice too much, cream too much, ice cream too much, cold things too much, and you stay in cool place, and then you get cold. Okay. So diet, what type of diet you should take to avoid this cold symptoms? Cold things, don't eat too much. Or you get cold and go to the pharmacy and take medication. Okay. Which is the best one? Prevention is definitely the best one. Prevention is definitely the best one. That's it. So if it fails, then you have to go to drugs. If drugs also fail, then you have to go. So the serious, the most complicated is the surgery, and the less complicated is drugs, and the least complicated is diet. Take proper diet, or take proper medication, or do proper procedure. When diet fails, you take medication. When medication fails, you take surgery. Which is the most appropriate one? In the initial stage only, take proper care by eating proper food and diet. That's it. So now let us check the answer here. So we are moving to the second round. Just a revision of that. Copy post link. Here it is. And then here it is. Copy message. Yeah. Yeah. Again, I have to tell you update scores. Otherwise, you will not. Huh? Every time I have to tell you. Every time I have to tell you what? Huh? One time you tell you have to be like it. Huh? Your scores is my encouragement to teach more, no? Now, after finishing this one, the doctor is telling, yes, sir, we agree. Okay. Now tell me, do you need an ordinary physician or do you need a specialist physician? That means for heart problem. Do you need a cardiologist or do you not just need a physician? Okay. Heart problems. Do you need a physician or a cardiologist? Now you can understand what I'm telling. Come on, answer. Now you have serious problems in OET. Now, do you need a nurse who teaches English, or do you need a doctor who teaches English, or do you need a teacher who teaches English? There are many teachers who are teaching English. There are many teachers. Go to any English teacher and then learn, because they teach all these techniques. Okay? That's it. Your wish. I am not a physician. I am a surgeon. I am trying to treat your sicknesses, vocabulary problems, grammatical errors, pronunciation difficulties, everything. I'm going to relate these things with you. This is called a skimming technique. People don't know what is skimming technique. Yes. Now you can tell me, what's the name? Kabir Singh. Did I say anything? I'm just asking your opinion. Now you can tell. What I'm saying is, my question is right or not. I'm not asking, I'm not deciding anything. You decide. It is your decision, everyone's decision. You have all the right to go to anybody to learn, provided they teach, provided you get. Okay? Yeah. I'm just questioning you. I'm telling you, you are my children now. Those students who have paid me 25, 30,000 rupees, they are my children. You are also my students. Okay? Should I guide them the right direction or not? Teacher, it is on my responsibility to guide you. Once you come to me, it is my responsibility to tell you. There are many teachers who are telling. Nobody can teach you reading and listening. You have to do it on your own. We'll give you question papers. We'll give you answer keys. You check yours. Do you know how to check and what to check and why to check and when to check and do you know whether it is right or wrong? Do you know that there is singular plural? Teachers are telling now. Most of the teachers are telling like this. Do you know how to check it correctly? That's it. That is it. That is it. Yeah. So now, next, we are moving down to the. So, is this technique, I'm not asking you anything, is this technique working for you? If it is a yes, continue, learn. If it is a no, you can go and relax and enjoy. You're doing many other works. If it is a yes, stay on the platform. If it is answer is a no, if it is not working, why do you waste your time? Go and do your work. Yes, that's it. Your decision. I don't want to tell you, come on, stand, stay here, learn, learn, learn. I don't say anything. It is your decision. If you feel that benefit is there, stay. Otherwise, some people are saying, you do on your own and you correct on your own. Yeah, you can do. They say, read everything, read everything, read everything, read everything. Then afterwards, try to find the answers. They're actually spoiling the way. This is called skimming and scanning technique. Yes, now I want to ask a question to Dr. Nadia. Is she there? Yes, Dr. Nadia. Did you get your answer to your question which you put in the beginning of this session?
Yes, now I'm getting it.
So
Thank
you
you so
understand that without reading you will know a lot of things, right?
Yes, exactly. Thank you so much.
Only the thing is you should think logically, reasonably, and wisely. That's all.
But this technique is for part A only.
Part A, part
Okay.
B also, part C also. I'll tell you when that comes, okay?
Okay.
I'll tell you when that comes.
Okay.
Right.
Thank you.
Yeah. So now with your permission, shall we go or move on to move on to the second round? Yes. With your permission, shall we move on to the second round? Yeah. Those who say yes, stay back. Those who say no, you can enjoy. You have a lot of work to do. You can enjoy there. Take your time to do whatever you like. Nobody's objecting you. So learn in the way how you want. And those who are gaining from this platform, you remain there. That's it. I'm your teacher. It is my name. I don't want to spoil my name. So I'll give you the best suggestion. And now let me tell you about myself. I have to tell you. Now, if still you have further doubts, new students, those who are first time on this platform, okay, you have to know about me because you should know your teacher. This is a medical test. No, this is not a medical test. This is an English language test. So you need an English specialist. I'm not telling I'm a specialist. That is you who are to decide whether I'm a specialist or not. Because I know what I am. I am an English teacher by profession. All my life went on teaching. I did not teach. I did not do nursing or medicine for 10 years and just now started just to make some money. No. Right? All my life went in teaching. And the first one is, I am academically qualified. Bachelor's in English literature. Bachelor's in English language and literature. Number one, academic qualification. That means academically I am fitted to teach English. Number two, I'm not only an English teacher, I'm an English teacher trainer. I teach teachers how to teach English. I teach teachers how to teach English. I am masters in English literature. And masters in English literature. Number two. Number three, I am bachelor's in education. Bachelor's education. That means qualified teacher, not just a self-proclaimed teacher. Self-proclaimed teacher. I'm not a self-proclaimed teacher. I'm a certified teacher from Kakatiya University, one of the toughest universities. Only 7 students got only 9 students got university ranks. The 10th student got only second class. And there is no distinction in the university, only a first classes. That much tough it is in B.Ed. And I am university 8th rank from social studies and English methodology. And that was a history in the university that English subject got university rank, because maths people get university ranks. That is my third qualification. I'm a teacher. Next one is, I'm a master's in education. I taught in B.Ed college and I trained a number of teachers. I'm professionally a teacher trainer. And lastly, I got a certificate from Cambridge University. This is called CELTA. Your certificate is OET. That means Occupational English Test. My certificate is CELTA, CELTA. Certificate of English Language Teaching to Adults. This certificate I got in 2005. And this is a teacher training certificate from Cambridge University. This is not a qualifying certificate like OET. This is not qualifying certificate like IELTS. That is just to prove that you are knowledgeable in English. This is to prove that, this is a certificate to prove that a person is eligible to teach English to adults. Certificate of English language teaching to adults. So this is what it is. And the next one is, I am experienced, 35 years of experience in teaching English. And I don't just teach English as a profession. If I wanted to be a teacher just for earning my bread, I would have been. I worked in all the professions, from primary school, KG to PG. I worked even in universities abroad. And I'm training here now. I changed all categories because I wanted to learn, because nothing satisfied me. So I did not even enter government job, because they give, complacence, stagnancy, because I'll be a teacher forever. For example, my wife is a teacher. She'll always be a teacher. But now, you see, from primary school till high school to university I went. And then now I'm doing my own things. We can do a lot of things. I get a lot of research. I study all these things, not just like that. When I study all these things and come before you, because you should not suffer. I'm not a teacher by profession, just. I'm a teacher by passion. And I'm proud to say that all my family members, my brother, sister, mother, father, cousins, relatives, mother, everyone is a teacher. The worst thing I wanted to be is a teacher, but God said, you dirty fellow, you be a teacher only. That's what it is. I'm helpless. Okay? So that's it. Whatever we don't want, God wants us to be that. So it is his wish. Maybe he thinks that I'll be a good teacher, maybe not a better or best teacher, at least a good teacher. So he said, these are my children, I am sending you, teach them properly. So that is my responsibility, that is my calling. So I am here with you. I do with passion. I'm not joking. That's a fact. Right. Then next, we are moving forward to the next round. Get ready. Some network problem, no problem. Where is this share screen? Yeah. So round 2. Answer each of the questions 8 to 13 with a word or short phrase from one of the texts. Each answer may include words, numbers, or both. Words, numbers, or both. Right. So this is it. There are 2 steps involved here. There are 2 steps involved here. Be careful. The first step is the same pattern like round 1. You should identify which paragraph it is. Then you should go into that room and pick up the, I want a pillow. Where will I go? I'm in Simon Sir's house. I want a pillow. Where will I go? Where will I get pillow? Pillow is related to bedroom. So I'll go to bedroom. Then I pick up the pillow and I come out. That's it. Common sense. Mere common sense. Part A is totally related to mere common sense. Practical application of the knowledge and proving that you have wisdom. That's it. If you want a pillow, you are going into the kitchen and searching for pillow in the kitchen is foolishness. And not knowing which room to go is madness. The same applies here. This is a house. There are 4 rooms, 1 kitchen, 1 bedroom, 1 hall, and 1 living room. You should know which room you have to go. Here also it is. When you want a TV remote, you will go into the living room. Why? When you want a spoon, you will go into the kitchen. When you want a knife, you will go into the kitchen. When you want a pillow, you will go into the... How come? Why don't you apply the same strategy here? You have a lot of common sense. Open up your brains and apply the common sense. What is the item there which is related to what I want and where should I go? First, you should identify what I want. Many people, they don't know what they want and they just enter into from A, B, C, D, everything they read, and 7 minutes they will waste and suddenly they will jump out for trying to find out everything. What you want, first of all, before going into the room, you should know what you want. Reading, 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 reading. No reading. Study, research, probe, investigate. That is a secret. That is called skimming and scanning. That's what we are going to learn now. Skimming is done. First round is skimming. Second round is scanning. Skimming means headings and subheadings. That's all. Now we are going for scanning. What should we scan? The second round, we have to scan names, numbers, new words, difficult words, special phrases. I'll show you. Many people say you should do skimming and scanning. What should I scan? You ask. No, some words you have to scan. Hundreds of words. What words we have to scan? And some important. What are important? No, some words are important. What important words? Can you label them? No, according to what you feel important. What I feel important, I don't know. That's why I'm asking you. Why don't you tell me what is that important thing that which I have to scan? I'm going to tell you that. This is not a general class. This is a special class. Right. Question number 8. Question number 8. There you go. In which category should a patient with a BMI of 28 kg per meter square be placed? Now here, I'm going to count from 7 to 1. Till then, don't submit, please. Let everyone get the chance to think. You are clever. Doctors are very, very clever. It doesn't mean that you will make the nurses lose their chance of thinking. If you write an answer immediately, they'll follow you. They'll think, this is it. That means they are guided by your. So don't test, please. If you are clever, also don't put the answer. Nobody should put the answer. When I count, I'm giving everyone a chance to learn. Trust me, united we stand, divided we fall. Yes. 7, 6, 5, 4, 3, 2, 1, and submit. It's okay. If it is wrong, no problem. I'm there to help you. I'm there to help you. Let me check. Wow. A. So many A's. Why Srija is crying? What's wrong, Srija? Ravindran, what's wrong with you? Okay. Huh? Okay. Fireball 08. This is the first round. Fireball 08. Okay. Now let us confirm whether it is in A or B or C or D. 28. Now I told you, you have to scan for this. 28 number. You should just scan like that. I'll show you the slides one by one. I'll show you the slides one by one, and you have to scan the number. Yes. 28 number you have to scan. Names, numbers, new words, difficult words, special words. In which category? Category is a word. Category is a word. BMI. Where do you find BMI? 28 kilogram per meter square. Where do you find 28? Number is very easy to identify. BMI is very easy to identify. Category. Different categories are classes, divisions, department, boxes they will show. That's very easy to identify. Now I am taking you to A, B, C, D. Now see here. Just a quick glance. A. Is it in A? Is it in B? Is it in C? Is it in D? Don't find the answer. I don't want the answer. Whether A is right or not. I don't want the answer, my dear Srija, Ravindran. Yeah. Now, tell me, where did you find this one number 28 or meter square or centimeter per meter square or whatever it is? Where did you find A, B, C, D? Where did you find? Come on, respond fast. Where did you find? Was your answer right? Don't write the answer, please. Only write A, B, C, D, because I don't want anything. So A, kg per meter square, BMI. Okay, here kg per meter square is there, BMI is there. Yeah, BMI is here, kg per meter square, is it there? Next is BMI here. Yes, BMI is here, kg per meter square is here. For which category is it? Category, where is category? You remember, category is the keyword. Okay, two places are there. BMI is here also. But which category? BMI is everywhere. But where is category? Yes, majority of you have written A. Right. Now let us see here. Now let us consider. That is the first step. Now I am giving you an option here. Okay, fireball 8. Create poll. This is needed. A, B, C, D, you have to guess. Category means classes, classification. Categories means classification. A, B, sorry, B, C, D. Quiz mode. Inductive and deductive methods. Now, what are inductive methods and what are deductive methods? I'll tell you now. Yes. So many of students said A. Now let us see. Yes. Now here we'll go to, you go and click the answer. That means you are going into the right paragraph. If your answer is right, you are getting the right answer. Yeah. Oh. Yes, check your answer there. Yeah. So now next question. Now let us see. I'll give you the same question, okay, in a different angle. Okay. Yes. Now here, what you can do is, yeah, here, leave a comment. Okay. So question number 9. What is this? Yeah. Yes. Yeah, here. Okay. Yeah. Short answer, please. Okay. So this is the slide which I am going to put you. Okay. Okay. Here. No? So yeah, this is 8th answer. No, it is only 7.5. It's not 8 answer. 7.5, not 8 out of 8. I'm sorry. We are not bothered about that one. It's only 7 marks you got. Now this is half mark only because we did not get the full answer here. We only went to the paragraph. That's all. Right. Now what it is don't hurry. Now here, yeah, this is the question. Which question I gave? Oh, sorry. Actually, this is the 8th one, right? Yeah. Yeah. Sorry. I should have taken this one. In which category? Yeah. Wrong question I added. Yes. So this is the question. Put a 20 out of 20 in your pocket, marks. So this is the question. Print a screen. Yeah, this is 8th question. Here we go. Yeah, fireball 08. Main slide. Yeah. Now what you have to do is, you have to click here and you can type your answer here. Okay. Again, just to go, I'm giving you the link here. Copy, post link. Okay. And then you can go there. If you click here, it will take you to here. Directly it will come here. See. It will come here only. Then you can leave a comment. There you have to open and you just type your answer there. So what is the answer? You said A, na? So I will take you to A. If you said C, I will take you to C. Right. 1 second. Yeah, first I am taking to A. A is here. So now, whatever answer you feel, you can write in the chat box. You can write in your answer in the chat box. Category, you can write here another word, category. Form of. What is the form of obesity? What is the category of obesity? What is the class of obesity? What is the group of obesity here? Which group? Which division? So like that. Write in the chat box. You should not write spelling mistake. Yeah. I gave you a link in the chat box. Okay, this is for people who said C. I'll take you to C now. Yeah, there are some people who said C, I think. So for them, I'm giving C. Yeah, A, C. Yeah, somebody said C. For those people C, you can go to C. I have given C. Find out which group it is there. Which group of it, category of obesity. Okay. So majority said A. So I'm taking back to A. Check and write down. So there are 5 different groups. Healthy weight group, overweight group, obesity 1 group, obesity 2 group, obesity 3 extreme group. Okay. So which category? You know that. What is the number? The number is 28 kg per meter square. 28 kg per meter square. Where it will come? 28. Will it come in this group? Or will it come in this group? 28. Where it will come? 28. 18 to 24, 25 to 29, 30 to 34, 35 to 39, 40 to above. So you have to write there. Okay. So 28, 28.00, 28.0 kg per meter square. That is it. So where does it stand now? 28 falls in between 25 and 29. So the answer is what? This is the group. Okay. So now you can give your answer. I'm not getting how to write answer there. Okay, you did not maybe become a member of the channel. I think that means you are missing many more things. Okay, I'll give you the link of the channel. Please wait. Telegram channel. Yeah. You should join membership here. No? Your member here. Yeah. So this is the link. So you can join there. Just click on that one. It will take join. Then you said join channel. And you can also join the group. Okay. Both you can join. Then you can write. Only members will be given permission to write. Na? Okay. Oh, sending message in this group not allowed. Okay. Let me check. Somebody is posting something, so that's why. Wait. Manage group. Permissions. Send messages on. Yeah. Yes, now check. Now you can post. Yes, somebody commented there. Yes. Absa Jailani, overweight. Very good. So like that you can answer. Good. Right. Like this, many questions I'll give you. Whenever you're now missing also, you can learn from these places. Right. Yes. That is the solution. I'm telling you, how to search. I'm telling you, kg per meter square is here. Over already in the question, he told what? In the question, what did he tell? In the question, he told in which category? Category means type, na? So go to A. Category means type. It's very clear here. So what are you supposed to do? Category means type. So go to A. Then there you see 28 kg per meter square. And there you see BMI. That's it. 28. Okay. So you have to go there and just check 28 where it is there. 28 kg per meter square. So kg per meter square is here. Kg per meter square here. All. So 28, in which category will it fall? 25 to 29. 25, 26, 28, 29. So 28 will fall in this. So overweight. So easy. Okay. Next question, number 9. Yeah. Question number 9. Question number 9. In which text can you find information about which group of patients may be most at risk? Which group of patients may be most at risk of comorbidities at high BMI? At high BMI. Which group of patients may be most at risk of comorbidities at high BMI? At high BMI. Now, tell me. Okay. Now here, you have one important thing. So word from the question. Word from the question. Come on, type the word from the question. Which group of patients may be most at risk of comorbidities at high BMI? Which group of patients? What is the word which you want to select here? In this white area. Come on, write down. What is the word which you want to select from this white area? Okay, very good. Most of you wrote group. That's when all of you participate. All of you participate. Now this group means what? A, B, C, D. Tell me, group means what? A or B or C or D? Yeah, that's it. So that means you have to go to A. You have to go to A. You have to go to A. That's it. So now let us check. You're absolutely right. You're absolutely right. Now I am taking you there. Follow, this is a learning stage. This is not exam. If you learn now and practice this, and the exam will be easy for you. Okay, now don't think like you are doing in the exam and you want to fat. No, you are learning stage. When you are crawling stage, you don't do running. You'll fall down. No hurry. So, fireball 09. Yeah, fireball 09. Yeah, inductive and deductive methods. Inductive and deductive methods. So you all said A, so I'm taking it A. Okay, now I'll take you to A. Okay. Yeah. All of you gave me A, so I'm giving you A. Categories, classes, groups, types, kinds. These are synonyms. These only will help you to find the answer. Yeah, now check your answer and wait. I'll give you some time so that everyone can learn. Then afterwards I'll count down. I'll give how much time for this question? 15 seconds. It's very much, too much. No need. But I'm giving you so that everyone will learn. Yeah. 7, 6, 5, 4, 3, 2, 1, and submit. Yeah. You can write your answer. Okay. Now you can see here very clearly. So the answer is in this paragraph. The answer is in this paragraph. Okay. That's quite obvious. Now let us see. He asked what? Comorbidity. Yes, risk. Comorbidity and risk. Okay, we should remember the question. We should bring the question here now. Okay. Yeah, because without the question, it will not benefit us. Okay. Which group of patients may be most at risk of comorbidities at high BMI? Okay. Now, if you see very clearly here, comorbidities is here. Yeah. Risk is here. Okay. The next, which group of patients? Which group of patients? So groups such as Asian family origin, number one, and older people, two groups are there, which have comorbidity risk factors that are of concern at different BMIs. And it is lower for adults and higher for older people. And he asked us high BMI, high BMIs, BMIs, BMI. So this is how you have to relate. High is here, higher. BMI is here in brackets. Lower for adults of an Asian family origin and higher for older people. Higher for older people. Okay. This is the way how you have to relate. Risk. Comorbidities. Okay. So that's very clear now. I hope you understand what I am telling here. So higher for older people. So the answer goes here. Higher for older people. Yes. So high for older people. That is the answer. So the answer is older people. That is the answer. So apply that logic there. It's not very difficult. Okay. It's not very difficult and there is no panic. You see how the order is going. Yeah. Yeah. Hello, Dr. Sumant. I'm fine. Can I call you after some time? I'm in a session now. Thank you. Yeah. Okay. Yeah. So short answer you have to give there. Now when you give short answer, so some students they write full answer here. What is that? Asian origin, an Asian family origin, and older people like that also they are giving. Be very careful. Answer will be limited. High or low. Low is Asian origin, then high is older people. Remember that. So here, oh, what is this? Yeah. Yes, here you have to submit your answer. Okay. Anywhere you can submit, no problem. Yeah. Type 2 diabetes and cardiovascular diseases. What is this? Type 2 diabetes and cardiovascular diseases. Ifza Jailani. What did you write there? I don't know what you wrote. Okay, right. So there are two things here, extremes, lower and higher. Lower BMI also is a problem. Higher BMI is also a problem. Comorbidities. Adults of an Asian family origin, they have lower BMI. And older people have higher BMI. So older people is the correct answer because he asked very specifically here higher BMI. That's you have to focus. This is the explanation for that. So you have to search for what? You have to search for the keywords. BMI, risk, comorbidities, group. These are the words you have to scan for. This group, okay, risk will relate to the first one, classes. The greater the obesity, the higher the risk. So it depends on classes. The greater the BMI, the higher the problem, the more problem. Okay. Then next. Now this is 10th question. Now here, 10th question. Look at the question. In which text can you find information about what daily calorie deficit is generally recommended? In which text can you find information about what daily calorie deficit is generally? What is the special word in this question? Geeta, don't write the answer. I did not ask anybody to write the answer. Let everyone think I'm deleting your answer. So, what is the word? Step by step I'm teaching. Nah? You are very fast. You got the answer. But what about the other students? Okay. So, what is the word which is telling in this white area? Which tells you which group you have to go. And now you answer. Yeah. Now everyone starts thinking. Nah? Mansi, no answer. I did not ask answer. Wait, please. Which word? That is calorie. Okay. Now I'm asking you, calorie is in which A, B, C, D, where you will get calorie? A, B, C, D. Where you will get calorie. Now you write. Yeah. So calorie is in B. Now, that's fine. So here it is. So this is question number 10. Rapid fireball 10. Yes. So you said it is in B. Now let us go to B. Okay. Let us go to B. I'll take you to B. So let us go to B. 1 minute. Before going to B, we have to take the question also. No? Okay. Yeah. Yeah. B. B is here. Now you want the question also here. No? I'll put the question here. Yes. This is the question. Yeah. This is the question. What daily calorie deficit is generally recommended? Okay. What daily calorie deficit is generally recommended? Now, do you think this information is here? Calories is in text B. Yeah. What daily calories deficit is generally recommended? Okay. Now, type the answer there. What daily calorie? What daily calorie deficit? Reason properly. Let's see. Is a day needed? Daily calorie is already written in the question. So why daily again? Hmm? Write down all of your answer. How it is written 600? How many people? You are not very careful. I don't understand why. Blessy, where is the space here in between? After 600, where is the space? Avil. Yeah, he has written. Rajeshwari, where is the space? Rewrite. All of you, rewrite. You want to lose marks in the exam? College, Dr. College. Write again. Write again. Do you want to lose your mark in the exam? The next. Mansi. Okay. Blessy. Okay. Rajeshwari. Okay. Simiath, right? Srija, right? Hifza, right? Geeta. Geeta, why day? What daily calorie is asking? Why again day? Is it necessary? In the question, it's already there, no? Why per day? Huh? So no need to write day, all of you. And kilocalorie, if after 600, there should be space. See, they are not here in the question. How it is there like that only you write. Okay. What daily calorie? What calories required daily? So daily is already there here. So no need of daily. It's already there. It's separate. What calorie? 600 kilocalorie. That's it. So simple as that. Okay. So simple as that. Here. Okay. So we went for B. Yeah. We went for B. Then next, after going to B, it's very clear here. If we take the question there and check it properly, okay, these are the words which are required for us. 600 kilocalorie. What calorie? 600 kilocalorie. Day is already there daily, so no need that one. Now, how do we identify this? How to get an idea that this is the word, proper word? Now, let me tell you. Dr. Nadia was asking me, how will we identify? Yes, that was a genuine question. But how will we identify? There are 5 different things. Note down. Note down. I will type in the chat box. Afterwards, note down. First one is number one, names. Number one is names. Okay. Number one is names. Right. Number two is numbers. Number two is numbers. Number two is numbers. Number three is new vocabulary. 4 is difficult vocabulary. 5 is special words and phrases. New vocabulary, difficult vocabulary, special words and phrases. Okay. So these are the 5 different things. Fine. You have to note them down. All of you, note them in your books. You have to search for these words. Her question is genuine. She is new to our platform. She does not know. So definitely I have to give the explanation. So, names, numbers, new vocabulary, difficult vocabulary, special phrases and words. Now here, this answer, you can identify because of this number. Number, how many calories? What daily calorie deficit? What daily calorie deficit? What is the number? How many? How many calories deficit you can give per day? Daily means day. So number is very much helping you. And the special word is calories. And the special word is calories. Kilocalories. Okay. This kilocalories will help you there. Okay. Number is very important. And he also repeated the answer. 600 kilocalories. Deficit. Deficit means less than. Deficit means less than. You can see here, deficit. You can see the word deficit. Deficit is a special word. It will be there. Special words, they will not change. And he's explaining less than. Answer is given 2 times. So don't you think that this is very easy answer? Okay, deficit also means less than also means deficit. 600 kilocalories is the deficit. You can recommend. So, in brackets means explanation of the previous. In brackets means explanation of the previous. 600 kilocalories less than deficit. Okay. Calories. Okay. So this is how you have to analyze the question. For me, explaining it is taking time. For you, you can just do like that. Many people answered fast. How did they answer? That's it. Yeah. So this is the way how you names, numbers, new vocabulary, difficult vocabulary, special phrases. Calorie is the word. It will take you to diet. There you go to B. Then you see what daily calorie deficit. Calories will mean number. 60 calories, 50 calories, 10 calories, 100 calories, 200 calories, 300 calories. You know that calories are numbers. You know how many calories you measure calories. How many calories I am gaining. Okay. How many calories I am burning every day when you walk. You know calories are measured in numbers. Don't you know? This is pure common sense. You use every day. Why are you not using it in education here, study here? Yeah. Why are you not using in education studies here? Calories, will they be in numbers or words? Numbers. Figures. Where are figures here? In this complete here, figures are only here. Only 600 is there. Other than that, nothing is there. Is it difficult to find a number? Is it difficult to find a number in a text? In this big, there is only one number. Is it difficult to find a number? I'm just telling you. But you should apply the logic. What calories? Calories are numbers. You have to apply that. So once you know that it is a number, then number you have to search for that. Why are you searching? Why are you reading? Are you crazy to read this full paragraph? I'm not crazy. I believe you're not crazy. But why are you crazily reading everything? I believe you are not crazy. But your attitude, reading from beginning to ending. Why? You have to scan. I just scanned. And I heard number 600. That's the only number. And next to that is kilocalories. So that is the same 600 kilocalories. I got what calories? How many calories? 600 kilocalories. Daily deficit. These are the collateral words. Deficit means what? Less than. It is already again written in the brackets. For those people who cannot understand what is their deficit, for them this word is there. The explanation also is already given out of brackets. Again, for the students who are very weak, it is given here. For whom did they give? For the weaker students. Why did they give in the brackets? To simplify. To simplify. Simplify for average students. The excellent students can understand out of the brackets. The ordinary students can understand less than means deficit. That is means that means they contain 600 kilocalories less than. That is deficit. Yeah. The same analysis you will have for part C also, but with a little difference. I will explain you there. Yes. So, next. Question number 11. Question number 11. So, what sort of diets should patients be advised not to follow? So, where will you go? A, B, C, D. A, B, C, D, type. So fast you are answering, see? Very good. Okay. So we'll go to B. So did you notice that they are going in an order? Second round is going in an order. First round will not go in an order, but second round is going in an order. That means first text A will finish, then text B, he will go, then text C, he will go, then text D, he will go. So they are going in an order from A is going to B. Now they are doing in B, then they will go to C. So it's going in an order very clearly because these are authentic materials. Fireball 11. Okay. So yeah. So this will help you to identify questions 1 to 7 and all 1 to 20. The same technique is applicable everywhere. Okay, you said it is going to be. Okay. Yeah. So let us now check to B. So majority of you have said it is B. So I have given B. Now I am taking you to B. Before going to B, we have to save the question also, no? 11, yeah. Okay. Now we can go. Yeah. This is A. This is B. Okay. So far, so good. Now, yeah. What sorts of diets should patients be advised not to follow? Okay. What sorts of diets should patient be advised not to follow? You check whether your answer is there. If your answer is there, think about the answer, wait for 20 seconds and then type. Let the others also think. The answer is there. Okay. Let us see now. Now here, what sorts of diets? What sorts of diets? Sorts means types. What sort of diets should patients be advised not to follow? Not to follow. So here you see not follow means use. Not to follow means not use. Advised, do's and don'ts. Do it is an advice, don't is an advice. Do not use, advise not to follow. Advise, do means advice. Not use means to use, means to follow. Advise not to follow. What sort of? So there only you will get the answer. Okay. Do is an advice. Not use means follow. What sorts of diets? What sorts of diets? Okay. Just gather information like that. Advice is the key word here. Advice is the key word here. Okay. Unduly restrictive. Unduly restrictive. What sorts of diets? Unduly restrictive. Okay, diets is already there in the question. What sort of diets? Diets is already there in the question. So what sort of diets? What diet do you eat? Vegetarian. What diet do you eat? Non-vegetarian. What diet do you eat? Chinese. What diet do you take? Continental. Enough. No need to repeat the word. So duly restrictive. If you write also no problem, but unnecessary. Yeah. Yes. 11th question done. Yes. If your answer is right, now you update your scores. So you can update your scores. How many answers you got correct? You can just update your scores out of 20, out of 11. You're writing in your notebook. Huh? You can update your scores. How many marks you got out of 11? Wow, wow, wow. Wonderful, wonderful. Oh my God. Huh? Where is our hero? Huh? Yeah, all 11 out of 11. Wow, what is this? Really, I'm surprised. I'm really surprised. Dr. Khalid Shelvi from Jaffna, Sri Lanka. Hello, Dr. Khalid.
Hello, sir.
Yeah, okay. Now I'm giving you a chance to speak. If you're comfortable, you can say a few words. What is the difference you're seeing?
It's really useful and time consuming. So the part one is we have to run in a very short time. So I think it's 15 minutes more than now for me to do complete the reading part A with your guidance.
Okay, that's good. Thank you. Yes. Next, 12th question. Yes. Now see, it's moving into the next one. From types, it's moved to diet. From diet, it is moving to something else. We don't know. Try to find out the word here. Function, print screen. Yeah. What is the word you think here, which is more important? Fireball, 12. Fireball, 12. Yeah. What is the word you think? Yes, 12 students have given the answer. Yeah, pharmacological. It relates to C. Yeah, that's absolutely fine. Rajeshwari, wrong. For me, A part was too difficult, but now I am able to answer easily. Thank you, sir. Welcome. Yeah. So now you'll go to this one. Okay. We'll take this. Question is important. We need that one. We have to take that one too. So we'll go to C. All of you wrote C. So we'll go to C. C. Okay. To decrease the font here. Huh. Earlier there were font styles here. Okay. I want this. Okay. clear. So it will not be clear. So I'm trying to do some gimmick. I'm putting in between these two spaces. Okay. So that you can understand. What is the minimum age for patients receiving pharmacological intervention? I did not get the font size adjusted, so I had to do that. Right. So this is the question here. Here the first part, and here the second part. This is how no confusion will be there. Okay. Now, okay. What is the minimum age? You will get a word or number. What will get? Come on, guess. Word or number? What is the minimum age? Word or number? Or word and number? I'm sorry, you're wrong. Both are wrong. It's word and number. Word and number, both. And sometimes I'll ask questions like that. 12 is a number. Years. Okay. What is the minimum age? Yes. Now submit the answer, please. So drug treatment is not generally recommended for children younger than 12 years. That means 12 years are okay. Younger than 12 years, no. That means younger than 12 is 11. 11, no. 12 is okay. So minimum is 12. Younger than 12 is 11, not okay. They are not recommended. So 12 and above are recommended. Younger than 12, they are not. Be very careful. Younger is there. Younger than 12. So that means more than 12 they can give. But he is not asking what is the age. He is asking minimum age. Means you have to give the least. 12 and above you can give. But minimum age is 12. That means at least you should be 12. Age is a number. You have to apply that logic there. Age is a number. Age will be number. And the only number in this is 12, 28, 30. And here also numbers are there. Very easy to identify numbers. But age, here it is BMI per kg, not age. So here it is years. So definitely this is age. So how to identify the answer? Very easily. No need to read everything. Age means number. Can't you relate? Why wasting time reading everything? Simyad, younger than 12 is wrong. Minimum age is asking. Again, you are giving younger than 12. Okay. What is the minimum age? So more than 12 is accepted. Less than 12 is not accepted. So the minimum age is 12 years. That is how you have to write. 12 years. Okay. What is the minimum age? Age is always told in 12 only, years only. So just if you tell 12 also, it is okay. Age? 12. What's your age? 35. What's your age? 45. No need to say years. It cannot be months, no? Age is years only. Exceptionally, it may be months or days or even hours. Then you need to say. But the years, you need not say. Because commonly, we tell in years. So remember that. So it is 12. That's enough. What is the minimum age? 12. Next. You're only telling answers. I'm not telling anything. Everything you are only doing. Question number 12. You said it is in C. So I'm taking it to C. That's it. So there you go. Minimum age is 12 years. Age will be numbers. And there are only 3 numbers. You have a lot of common sense. Apply that common sense. Yeah. Next one. Question number 13. In which text can you find information about? So it is going in an order. Second round is going in an order. That means question number 8 to 13 are going in an order from A, then B, then C, then D. It's a system. They'll always go in an order. Understand? Make a point of what I'm telling. Yeah. Question number 13. Now you think A, type B, diet, C, drugs, D, procedure. What do you think is the answer? What is the word that is going to help you here? Yeah. What is the word and where you will go? Okay. Okay, fine. You said you will go for D. I agree with you. You are very wise people. I'm not so wise as you. So definitely you can lead me the way how I'm going. Actually, I'm not teaching anything. Whatever you are telling, I'm writing there. So who is the teacher? You are only the teacher. I'm just tracking down properly, systematically managing your things. I'm not doing anything here. I'm just streamlining your process of learning. Other than that, nothing. You are only telling the answers. Did I tell you one single answer? So you said D. Okay, I'm clicking D. Now, let me take you to D now then. So before taking you to D, I have to take this question also, right? Okay. Yes. Here is D. I did not drink water for so long. I'm shouting and talking. Can you please help me with some T or something, please. So, just to remind me, sometimes I forget. So, don't know how to make it small and big. This new style has come and it is disturbing. Settings. No. Okay. So let it be like that. Which type of surgery is not permanent if patients undergo a subsequent procedure? Some other procedure next. What type of surgery is not permanent if a patient undergo a subsequent procedure? If they do not undergo a subsequent procedure, it is permanent. But otherwise, it is not permanent. What is that? Now check your answer there. Which type of surgery? Which type of surgery? Surgery type. Type doesn't mean that A now, because surgery is more important. Types means classes, but here surgery is telling. The most important word is surgery is there. So now, procedure, subsequent procedure, procedure, type. Can you see here? Yeah. Now you can give me your answer. Gastric band, gastric sleeve, gastric bypass, gastric balloon. Come on, which is the right answer here? Yeah. Geeta says gastric balloon. Srija says gastric balloon. Then Kalai Shelvi says gastric balloon. Then Avil says gastric band. Huh? Okay. Now you should know here gastric, somebody wrote gastric bypass. So let me tell you, gastric bypass is non-reversible. That means it is permanent. Don't you understand? Gastric bypass is non-reversible. That means this is not, this is permanent. But we want not permanent. But this is permanent. Non-reversible means permanent. It's permanently staying there. Non-reversible. You cannot bring it back. In the same way, gastric sleeve is also not reversible. Okay. Try to understand that. The next one. This is gastric balloon is for temporary. It's for 6 months or 12 months. Gastric balloon is for 6 months or 12 months. Okay. So it's just 6 or 12. If they undergo a subsequent procedure, is telling. And this is reversible. For 6 months at least you have to keep it. If you take a gastric balloon for 6 months, you have to keep it. That is permanent. For 6 months. That's permanent for 12 months. Okay. Temporary only. But for 6 months it is permanent. No? Temporary period, but permanent. For 6 months you cannot do anything it. Or 12 months. If you fix for 12 months, it will be for 12 months. If you fix for 6 months, it will be 6 months. Okay. Before that, you cannot do anything to that. Okay. So that you have to experts, you have to tell that. The next one here, this is reversible. Reversible means it is not permanent. Okay. Reversible means it is not permanent. After this one, after gastric band, if some other subsequent procedure is undergone, then that means it is not permanent. It's reversible. So it is gastric band. Okay. Right. So you should see this one here very careful. So reversible is the key word. And if reversible is the key word, answer is gastric band. Yeah. Thank you. Thank you. Yeah. 13th question. Reversible is the key word. Double word, double circle. Okay. Yes. 13. So second round. Now tell me how many marks you got. So the answer is not permanent. Opposite is temporary. But for 6 months. Okay. It's a fixture, right? Not permanent means temporary. It is the opposite sense. Okay. It is the opposite sense. Yeah. Here not permanent. If condition is there, if patients undergo a subsequent procedure. So if they undergo a subsequent procedure, this is reversible. This is not reversible. This temporary, whatever procedure happens also, it is there like that only. Okay. Which type of surgery is not permanent if patients undergo a subsequent procedure here? This one. So here, whether they undergo a subsequent procedure or not, this will be like that only for 6 months. Gastric balloon. Doctors only can explain. Okay. Yeah, both are non-permanent, but this is reversible, right? Here, temporary. This is non-reversible means permanent. This is non-reversible permanent, but this is temporary for 6 or 12 months. It is permanent. It's temporary period, 6 or 12 months. Okay. 6 or 12 months is for temporary period. Try to understand that. Temporary period, 6 or 12 months. Permanent means lifelong. Temporary, long term. Think like that. And then here, reversible. Reversible means, okay, the condition here is here. If if is the condition here. If patients undergo a subsequent procedure, then it is reversible. Automatically it will, by default it is done, gone. Then it is not considered permanent. Okay. But gastric balloon, see, it's temporary. It should be for 6 to 12 months. Okay. So that is telling here, this is reversible. Okay. This is reversible. This is not reversible means no turn back. This is not reversible. Okay. This is for a permanent period. It is not reversible. This is permanent period. I'm telling you one more clarity now. This is for a permanent period. It 100% not reversible. This is also 100% not reversible. That means lifelong it is like that. Okay. But this one is for a shorter duration and it is permanently placed. It's 6 months minimum. But this not 6 months, 2 months, 1 month, 3 months, anytime. If you undergo a procedure, this is reversible. That's it. This is not reversible for 6 months. You have to keep it like that. 6 months duration or 12 months duration. It must be there. It's a permanent fixture for limited period. So see here. This is permanent fixture for permanent period. This is a permanent fixture for limited period. This is a fixture when another procedure goes, it is reversible. These three are not reversible. These three are not reversible. Must be there for 6 months, must be there for lifelong. That's it. Medical professionals. So that depends on reversible, na? For the other things, it's temporary period, 6 to 10, 12 months. 6 to 12 months. That for 6 months, it must be there. Means permanently placed for 6 months. Okay. Temporary period means short term, long term. That is the meaning. Temporary period, long term, permanent means temporary job means 2 years or 3 years or 5 years or 10 years. This is temporary period. Permanent job means till 60 years. That's all. Permanent doesn't mean lifelong. Even then, even job also is not lifelong. Lifelong means 99 years. I will live 99 years for work. No, that is not. There is a difference in opinion there. Right. Permanent means long term. Okay. And temporary means short term. That's the meaning. Short term job, long term job. That's it. Not lifelong here. Okay. Right. Next. Temporary you fix for 6 months, then you cannot change it. Nothing will happen to it. But here it is reversible. That means problem happens automatically. So that's why it is not permanent. Okay. Function. Yes, that is solution. I hope I could help you to some extent. Okay. Yes. So we'll have dinner. So that's the session. This is second round. We have third round yet to do. So if you're pleased with okay, you can just say how beneficial was this session. You can grade it from 0 to 100. And write one sentence, please. And we are starting a new batch on Monday. So regular, this is our demo session. So those, yes. And if anybody wants to attend regularly, you can join, you can subscribe, those who are watching on the YouTube. Okay, this session, these lectures which I explained, so that you can understand these techniques you can apply in all the passages. Slowly, slowly, slowly apply. Gradually you learn all the techniques. And by the time of your exam, you'll be perfectly fine. Just write some sentences. What do you need? Do you have any suggestions for us? Do you have any suggestions for us? Do you have any requests for us? You can, yeah. You can just message me. You can invite your friends. You can pass on the goodwill to others so that others also will learn. Yeah. So that is the end of the session. Good night. So I'll have my dinner. Question number 13, we did not put. We put no. Two wrong side. This one. Be able to understand. With same technique for 27 questions you are applying here also. Correct? And after scanning also, that's skimming only, the scanning also. Takes time, little. Don't hurry. Don't panic. Don't get upset. People who don't follow, no, they face difficulties. If you follow, that's say how much strain I am taking to explain it. It's not easy. Is the reason why, first of all, nobody knows these things to teach. They know they will teach. Why to take headache? I'm getting money, what should I get? Like that they I'm online still. So those who are on the YouTube, if anybody is interested, you can get back to us. You can subscribe for our courses. And here we are with you.